we're joined with Ashley Ducote, who is a licensed practical nurse. She's been on the front lines dealing with, all this stuff with the coronavirus, COVID-19. So, Ashley, thanks for being here.
No problem. Thanks for having me, guys.
So, the big question that I want to know is how are you, first off, before we get specifics, how has all of this been for you? Is this something that, obviously, I would guess it's something you've never seen before, but, how have you adapted to it?
I definitely did not think I would be dealing with this so soon out of nursing school. I graduated in December 2018, so I did not think this would be something I would have to be handling as a new nurse in any way. But it definitely has impacted the stress level that everybody is feeling. Everybody is on edge. Everybody is ready to get back to what their regular routine used to be, but it's definitely not something that is easily transitioned into. It takes time, and it's definitely a lot emotionally draining, more than physically draining, dealing with this whole issue. And I've seen kids that have had it, I have seen adults that have had it, and more times than not, it is more emotionally draining than physically draining, having to handle the kids and the adults with it.
So Ashley, what's it just been like in the hospital for all of the medical workers in the community? Obviously it's chaos, but can you tell us, kind of what your experience has been so far with all this mess?
I offered to go work in the hospital when all this started. They asked my supervisor, who's had hospital experience, who hasn't, who can go work, who can't. I offered from the beginning. I didn't have to go till about 3 weeks ago, and I was preparing for the worst, but we have to go in the unit that I was on. We change into scrubs when we get there, so it's not on any of our clothes or any of our scrubs. Then we put on what I call a bunny suit, and you literally go from your ankles to your wrists, and you zip it up, and you put on shoe covers that cover over your hair and one set of gloves, and you have to wear a mask at all times. You have to wear the N95s and then a face shield. So that's just going into the unit to deal with these patients. But we don't necessarily have all the proper PPE in the hospital setting. If you walk in a patient's room and you don't have it, then they just say, oh, well, it's all locked up in supervisors' offices. You only get one N95. It's definitely resources are definitely strained in the way that not everybody notices, and everybody's like, oh, well, you're getting PPE. Trump is saying you're getting PPE, but it's not necessarily going all over like everybody says it is from my end that I'm seeing.
Now, when all of this really started, there was a lot of the main symptom was coughing, and now obviously in the 2 or 3 months that this has been bigger, not only in America but in the entire world, there's been more symptoms that have come out. For you, kind of seeing people that have it or know people that have it, what are some of the main symptoms that they are experiencing?
A lot of the people that I've seen that have it, the older adults that I was taking care of, they all had a very wet, kind of nasty, kind of allergy sounding cough, and they also all were having shortness of breath. But what happened was right around Mardi Gras in the pediatric clinic I work in, kids were coming in super sick, and it wasn't a thing in Louisiana or pretty much the United States really, and kids were coming in super sick. We would swab them for the flu, and it would come back negative, and we were like, I swore this kid had it. I know this kid had the flu, and they weren't testing positive. So we were thinking that was the beginning of all of this. My doctor, my primary care doctor, actually thinks that I did have it because right around Mardi Gras, I had a stomach bug, and I had to go to the emergency room and get an IV and get a bag of fluids. And then because they're saying the GI symptoms, the nausea, vomiting, diarrhea, whatever, starting a week before the cough and congestion and all of that. So then right after Mardi Gras, I had a cough for about a month until I finally talked to my doctor, and he's like, I do think you did have it. And he's like, but you would test negative by now, so there's no point of testing you. It's very hard to get tested. And a lot of these kids that are coming in, I've only seen 1 or 2 kids that have been swabbed for it out of the clinic that I work at.
So I want to know, because there's been reports of people who have been dealing with patients of COVID-19 who have wound up, it's taken a huge toll on their mental health and their lives, to the point where some of them have committed suicide, unfortunately. How has this whole pandemic changed your life and, your well-being?
It's definitely mentally exhausting going to work knowing that these people, it's hard for them to not have their family with them. It's hard for us to not allow family in and see them. They are able to drop packages off, but it's still not the same. And I mean, we are able to like FaceTime with their family, but for us, it's more mentally exhausting because I had a patient that her husband passed away when they were both in the hospital. And she's like 92 years old, I think. And she's just crying to me, telling me like, why won't y'all just let me die? And it's like, it's hard to sit there and watch this woman asking for that. Like, I am almost tearing up in the room with her and she's just bawling. And I'm like, there is nothing else that I can do for this woman. And so it's like, you're having to sit there and you're dealing with your own emotions, but you're also taking on the emotions of the patient, the family, and everybody else that's involved in it. And it's stressful, and everybody's high stress because we don't have as many resources that we need. And it's stressful going to work every day, pretty much.
Now, the New Orleans area was, or in Louisiana in general, it was well reported about a month ago that at one point it was the highest increase of cases in the entire world. Where is Louisiana at? Obviously, you're only treating patients in Louisiana, but how has this gone? Obviously, it's down a little bit, but do you think there is significant progress being made towards the state reopening in a couple weeks as it is right
now? I think reopening in a couple weeks, like Jefferson Parish. The other day I saw on the news that we are only about 100 to 150 cases behind New Orleans, and they are not allowing outside food places to open up. They're not allowing any seating outside. So for us to be so close to New Orleans and they have such different rules than we do, I don't think it's smart to really open up at this point. But I think last I saw, I think we were like Louisiana as a whole was the 7th in the United States on the amount of deaths per capita in either New Orleans or the whole state. And I think that says a lot, considering you wouldn't think that we would be, but yeah.
Now, if you think you have it, what's the best way to go about contacting a hospital? Because you obviously can't just drive there, especially with other people. There's been a lot of information, people saying call, what is it? There's one of the hotlines. Is it 299 or it's one of those hotlines, and other people say, call urgent care or hospital. What's the best thing a person can do in that kind of situation?
Definitely, if you have a primary care doctor, I would call them to see what their procedure is, because sometimes they may say you might qualify for some of the symptoms, but if you don't have either the shortness of breath or the cough, they aren't testing. So I would call your primary care doctor and see what they want to do regarding testing, just so that way, in case, whether they would say, okay, go to, because there's specific urgent care that are set up for it. There's specific doctor's offices that are set up for just COVID testing. So call your primary care doctor, and if not, you can call one of the urgent cares in the city and just say, I think I have the symptoms. Are y'all testing? Because they would most likely allow you to come in. Emergency rooms really are kind of bare right now. Not many people are going in. So if you feel like you have it, you can go in there, because they do have the proper testing and PPE for all of the healthcare workers. So you'd be able to get tested there too.
Now, I'm also interested to know, there's a lot of protesters out there who want everything to open back up, between ice cream shops and hair salons. What would you say from a medical standpoint to people like this who are out and want everything to be opened up when the threat is clearly still here? What would be your medical advice for that?
I think depending on the amount of cases, what stage you are in and reopening, what phase you're in reopening, and I also think where it's at. So like some states that don't have as many cases, I wholeheartedly think that they can slowly open back up and do what they need to do, wearing the masks, everybody wearing masks, and kind of social distancing still, sitting outside, not being in contained areas with more than 10 people. I think that is a good way to go about it. But how we are still having positive cases and deaths kind of daily, even though it's less, I still think we are not, as New Orleans and Jefferson Parish, all that, I don't agree that we are able to open up. Just like Governor Edwards said, I don't think we're at the point where we can just let everybody go. And I think the people that are protesting in other states, if their government feels like they can open up, then I agree with doing it. But I don't think having large gatherings, I think that's still a big risk for a lot of people.
I want to know what you think of, when you go on social media and see people who are just so against wearing masks and practicing social distancing just to really be a burden. I mean, it's frustrating for in that field, but for you who are treating patients, who are seeing how this is affecting patients, how does that make you feel?
It's kind of frustrating because I guess they're not taking the proper precautions, and it's almost like it's telling us like, oh, I don't feel the need to take proper precautions because you're doing it, you're fine. It's frustrating for medical workers because we're having to sit there and say, okay, well, we have to do all of this stuff, even when we're at work, if we're going into a place everywhere. Like I have a mask in my car, I have gloves in my car for like when I pump gas, things like that. So it's frustrating for me when I see people that don't take the proper precautions when we're still on the stay-at-home order and when they're still like advising us to take the proper precautions. It's frustrating for me, at least.
Now, let me ask you this. All of these medical professionals are doing so much work in the country now. I mean, they're arguably the most important profession in the entire world right now. What is it that you would like to see from the public or even the average citizen to be able to show our support for all these medical workers who are working nonstop hours, putting their life in danger? What could the public do just to show the medical community our support?
I think personally, like for me, I would like to just see everybody just listen to what is happening. I know like it's been 2 months that we've been at the stay-at-home order. I understand it's frustrating to be stuck at home. I understand it's hard doing nothing but sitting at home and looking at the four walls of your house or going outside or maybe just going to the park. But I think if you stay at home, this will go away faster than most people think. And I think people not staying at home and wanting things to reopen back to normal, I think for me, it's like a slap in the face because I'm like, okay, if I'm sitting here doing tons and tons of hours in a job that I love and I totally am still wanting to do after this, that's what I signed up for. But I don't think it's fair for me to say, oh yeah, I'm doing all of my stuff, but y'all can go do whatever you want. And I think if people just listen to what the government is saying, listen to their suggestions, follow what they're doing, this will go away sooner than what they believe.
Ashley, thanks so much for your time, and thank you for what you've been doing over the last few months as well.
No problem. Thanks for having me.